26 staff, and 7 students. In our independent schools, where most learning is in person, most of the new cases are associated with students, 39 students and 3 staff members. We've already observed secondary transmission associated with school or school-related activities, and this means one student has passed the virus on to another student. In all, 40 of our county schools have reported either a case of COVID-19 or a close contact of a case of COVID-19, either with a household member or a parent. And these reports are increasing as the month of August moves forward. Reports of school-related cases, along with the high incidence of cases in St. Louis County, almost 200 cases now per day in the county, are concerning. While the rate of new cases among 15 to 19-year-olds continues to increase, the rate of cases among younger students has remained relatively steady. For that reason, we expect to be able to recommend a return to in-school learning for younger students first, but we're not yet ready to make a prediction on what time that will be or offer a timetable. We'll continue reviewing cases and sharing information and data points on our website at stlcorona.com. Any changes made will be made in close communication with our schools. We remain in constant contact with our superintendents as school reopening continues and the new school year progresses, so we can identify challenges, but also understand any changes that need to be made to protect our students or our staff in these unprecedented times. We continue to recommend that everyone in St. Louis County continue to maintain social distancing, wear a mask, and wash your hands frequently. And if you are in close contact with others outside of your household on a regular basis, you should consider having a COVID-19 test. And you can make an appointment for a test through our website at stlcorona.com or call the County Health Department at 314-615-0574. And I would be glad to answer any questions.
Dr. Page, you kind of mentioned, about a month ago at this point, those new restrictions came down. You kind of said, about 4 weeks, we'll see where we are. How are things going? Could restrictions be loosening soon? Kind of walk me through that.
So restrictions in general, we're watching very closely as we see across the state that COVID-19 rates are increasing. In St. Louis County, we're holding steady, trending down slightly. We're not yet ready to recommend changing any restrictions on activities in our community, but we're watching this trend very closely. We do believe that the new cases are trending slightly down in St. Louis County. We need to understand what the impact of mixing in our school settings will do to new cases, because we know we will have some gatherings associated with schools, and we need to continue to watch the new admissions in hospitals. Over the past week or so, especially the past few days, we've noticed a trend upwards. So we're not ready to make any changes yet, one way or the other. We're going to hold steady and continue to watch the data and listen to our public health experts. What will happen next, I believe, is that we'll review the data among younger students, where transmission appears to be holding steady. And if we can get those younger students back into an in-school learning opportunity, that will be our next priority.
Is there a number of businesses who were reported and didn't follow some of those restrictions? Is there like a hard relative estimate number of businesses, or did you not have any that were reported?
Historically, since the beginning of this pandemic in March, almost all of our businesses have followed our public health recommendations. They really just ask us to tell them what's safe, what's the right thing to do. As I move about St. Louis County, I see the signs up on every door of every business telling people to wear a mask. I go in and see people wearing masks almost universally now in St. Louis County, and I believe that's why our infection rate is holding steady and even trending down some in St. Louis County. We are going to watch what happens with schools very closely as we get kids back together. We know we have some student-to-student transmission, especially in the 15 to 19-year-old range, and that's our top concern right now.
Thank you.
Any questions, Doug? Okay, thank you.